Hi there everyone, my name is Patrick. I'm an Educational Fellow in General Surgery. I'm just going to do a quick presentation on portfolios, some tips and tricks, and hopefully you get a little bit out of it. So first thing to do is just a couple of things that I'm going to go through. So I'll give you some sources of information, have a quick chat about how COVID-19 affects the interviews and the portfolios, because it does quite a lot, really. What's a good portfolio structure, and then questions, and a look through my portfolio. Okay, so these are some links for places that you can go and get information, because the way you should be thinking about your portfolio is you should start early preparing it, but it needs to be specific to the specialty that you're applying to. So most specialties will have guidance on portfolios. This is just a few links for ST3 physicians, IMT. There's a link for core surgical training. I've got a couple of slides for general surgery, ST3, because I'm more geared towards surgery, but the things I'm saying apply to most specialties. The top resource is Health Education England's advice on how to do a good portfolio, which covers a lot of what I'm going to say in a handy couple of A4 sheets. But you really need to tailor your portfolio towards what the portfolio structure is. So you need to get a copy of what the scoring sheet and then build your portfolio around that, because that's how you're going to ultimately score points. The last link there is just medibuddy.co.uk, which has actually good summaries and advice for multiple different specialties. So it's worth popping on there and having a look. Okay. So this is an example of a portfolio structure sheet. So this is for general surgery SC3. So you can see it's broken down into multiple different blocks for which you'll get points. And so each specialty scores things slightly differently, but for each, in general surgery, you get a point, up to 5 points in each block, depending on how far you've got. But in general surgery, you also get a modifier. So if you're straight out of foundation and then core training, you'll get a modifier of 1.66 to it. So you actually have to only score 3 in each bracket to get maximum points, and then that decreases the time after. Other specialties do it a bit differently. So orthopedics is just you get a negative multiplier and things like that. So you just need to have a look at whichever specialty you're applying to and whether that applies. So you can see that here it gives a lot of information about what they're looking for, and this is exactly how you should be structuring your portfolio. So you should have a contents page, and then your first section will be additional postgraduate qualifications, next section will be prizes, next section clinical knowledge, that kind of thing. And then that's how you should do it. And you should look at what you've got and how you can showcase your evidence to what is in the portfolio score sheet. So for example, in additional postgraduate qualifications, you get 3 points if you have a diploma awarded. So the easiest way to show that is to put your diploma in there, a certificate of your diploma, okay? Or if you've got over 2 national prizes, say, you just put those into the national prizes in order, and you'll get that, okay? The next ones are a bit different. So for example, surgery uses an online portfolio by ISCP, and you can print out your work-based assessments and put them in. Okay, you can see courses there, so you put all of your courses into that section, and audits. So we'll just move on to COVID-19 changes. So obviously it's affected everything massively, but this year the next set of interviews, all face-to-face interviews, are going to be replaced by online methods, okay? And so you're probably not going to have a physical portfolio like we have in the past, which it has its advantages and disadvantages. You don't need to buy a portfolio. You can be and you're going to need to be quite limited on the information that you give. So for example, for the ones done this year, you had to upload your evidence to Oriel. So every PDF you had to upload, and then you had to do a self-assessment scoring. which was then possibly vetted by consultants. And they asked you to upload the minimum required. So say you had 5 national prizes, they only wanted you to upload 2 because that would get you your maximum marks, which is a bit difficult because it doesn't give you a bit that wiggle room, because at the interview you bring a portfolio, and if they disagreed with a piece of evidence, you could say, okay, fine, maybe that doesn't count, but I've got other things. So it might make things a bit more difficult, but you need to be super specific about what you upload and make sure that you reach each one. Okay, so again, some of these may be redundant, but most of these generally apply for paper as opposed to online, except for probably the contents. Okay, so you have to be clear and concise, even if it's in an interview or you're uploading to Oriel. The people looking at your evidence only have 10-15 minutes to have a look at it, so they don't want to have to be trawling through each individual section to try and work out if you maybe had a full cycle audit or a half cycle audit. What you want to do is you want to show evidence that shows, I have performed this full cycle audit, here is the certificate from it, here is what was found, kind of thing. You don't want them to have to be trawling, because they're not going to do that, and they're just going to mark you down. Okay. As I said before, if it's a more formal portfolio, you need to structure it in similar ways to the portfolio checklist. So each section should be a section of the portfolio checklist that you've been given. Okay, and then that's just easy for them to follow, and it makes sure that they can give you the correct marks. Okay, so if you're having a portfolio that is physical, normally what you should do is you have a contents page for an overall contents page, and then each subsection, just like you saw in the ST3 for general surgery, there was 10 subsections. Each subsection should have a description, and then they can easily go to where each one is. Good idea is to have dividers that show where each section is. Okay. And so the next point is to use summaries for evidence. So this is really useful. So what I do is, say I've performed an audit, I'll have an A4 sheet that says what the audit was, whether it was full cycle or partial cycle, what the guidelines were. Hi there. Hi there. I've just started the presentation, but there's no one else in here, so I'll go back a bit, if that's all right. So this will be uploaded again onto the webpage, so you can watch it after. So just going through good portfolio points. So I was talking about how COVID-19 is probably going to change things. So you won't have a physical portfolio, but you'll have a online portfolio. So you won't necessarily need a contents page, but the same thing applies. You need to follow a structure for your portfolio similar to that which has been given out before. In each section, it's important to put the most important pieces of evidence first. So if you get points for national prizes, you put your national prizes first, because that's what's going to get you the max marks. In the audit section, if you get max marks for full cycle audits, put that first. Don't put it in chronological order, because it might be that a weak piece of evidence is the first thing chronologically. Just put the things that are going to get you the top marks, because they're probably not going to look through all your evidence. Okay. And again, when you're doing these summaries, use the same wording that scores the check in the checklist. So if it says international prize, make sure in your contents page it says international prize for, and then you have your evidence later on. Same for if you have audits, but you put full cycle audit, and then you'd have the evidence later on. Okay. If you have any evidence like certificates or work placements that aren't in English, you will need to get translations for them, because they won't be translating anything. Okay. And the other thing to say is that you really need to make sure that there's no patient identifiable information at all, because if there are, they could refer you to the GMC, and you won't be applicable for a training number then. Okay. So that's the end of the presentation. Again, if you join late, you can catch that up. But what I can do is I'll just stop sharing my screen and show you my portfolio, and then you can ask some questions if you want to. Okay. Right. So this was my portfolio. So again, it's going to be different this year. There's not really going to be a physical portfolio. There's going to be an online portfolio, but again, it's similar structure. Okay, so I had a clear table of contents. I don't know if you can see that there, but you have to be completely clear in where each section is, and I've said each tab, and then I've divided it up for the tabs. And this corresponds to the portfolio mark sheet for general surgery ST3, and so you can so that they know exactly where to go. So if we then skip to say a section which is audit, okay, I've then got a subsection with all the audits that I've done, and I've put all the closed loops at the top because that's what gets me points, and then single after, and then other ones like national audits I've put further down. Okay. Again, this might be less applicable for online portfolios because they're going to want you to be really selective and only put the absolute minimum in, but that might be it. So that, and then I can show you examples. So what I did was I did a summary. It might be difficult to see, but basically I just put the title of the audit, it was a full cycle, what the guidelines were, what the criteria were, and what the outcome was. And so they're probably not going to read this, to be honest, but it also it's there if they ask questions, if it's in the interview, or it's there for them to have a look at if they query whether it was a full cycle audit or whether you actually checked anything. And then after it, I have a letter, a statement letter to said that I did it, and this is the proof that I performed the audit, signed by the lead on that audit. I think, and that's the same for each one. Like for example, when I've done my teaching, I've got the feedback, I've got the lesson plan, but then I've also got it abbreviated to show a selected feedback that I did and what the situation was, so they can quickly see. And then the next page will be a letter of evidence to show that I've done that teaching. So and then it's structured like that. And then right at the beginning, I probably should have started with this, but right at the beginning, I've also included essential things that aren't necessarily on the portfolio, but things like essential. So you often have to include a checklist with your portfolio, the application form, a CV. So I've got all of that, evidence of ALS, and that I'm registered with the GMC as well. So that's got all my sort of essential documentation that they ask for. Okay.